Welcome to our channel. Today we're diving into the dark secrets of hair fall and hair transplantation that you need to know. We're bombarded by miracle cures and quick fixes, but the reality is far more complex. Hair loss is a deeply personal issue, and it's important to approach it with knowledge and caution. Over the next few minutes, we will uncover the hidden truths that many clinics don't want you to know. This is about empowering you to make informed decisions about your hair and your health. When it comes to hair loss, we often jump to solutions without addressing the root cause. Many people try different shampoos or oils, hoping for a miracle. But what lies beneath the surface is just as important as what we put on top. The scalp is often neglected in the quest for hair growth. Think of it like the soil where a plant grows. If the soil is unhealthy, the plant can't thrive. Similarly, an unhealthy scalp, riddled with inflammation or clogged follicles, can hinder hair growth. Factors like dandruff, seborrheic dermatitis, or even fungal infections can contribute to hair loss. It's like trying to water a plant with a blocked hose. The water just can't reach the roots. Addressing scalp health is crucial. Consult a dermatologist to identify any underlying issues. Sometimes simple changes like using a medicated shampoo or incorporating scalp exfoliation can make a world of difference. We all know that diet impacts our overall health, but did you know it plays a significant role in hair growth too? Deficiencies in essential vitamins and minerals can contribute to hair loss. One common culprit is iron deficiency, particularly low ferritin levels. Ferritin is how our bodies store iron, and without enough, our hair follicles don't receive the oxygen they need to grow. Another often overlooked nutrient is vitamin D. Vitamin D deficiency is increasingly common, and studies have linked it to hair loss. It's important to get tested and address any deficiencies under the guidance of a healthcare professional. Crash diets or extreme weight loss can also shock the system, leading to a condition called telogen effluvium, a fancy way of saying temporary hair shedding. We're constantly bombarded with advertisements for miracle hair growth oils and shampoos. It's tempting to believe the hype, but the truth is, excessive reliance on these products can sometimes do more harm than good. Many of these products contain harsh chemicals, even those marketed as natural. Sulfates and parabens are common culprits lurking in many hair care products. While they may create a rich lather or pleasant scent, they can strip the hair of its natural oils, leading to dryness, breakage, and ultimately hair loss. It's like washing your hair with dish soap every day. It might get squeaky clean, but it's not doing your hair any favors. Instead of falling for marketing gimmicks, focus on gentle, sulfate-free shampoos and conditioners. Look for products specifically designed for your hair type and concerns. Hair loss isn't just a physical change, it can take a toll on our emotional well-being. Losing your hair can significantly impact your self-esteem and mental health. It can make you feel self-conscious, anxious, and even depressed. This emotional distress can create a vicious cycle, as stress itself can exacerbate hair loss. It's important to remember that you're not alone. Many people experience hair loss and it doesn't define you. If you're struggling emotionally, don't hesitate to seek support from a therapist or counselor. Remember, addressing the emotional aspect of hair loss is just as crucial as treating the physical symptoms. The market is flooded with over-the-counter treatments promising to regrow hair, from serums to supplements. But the reality is that many of these products lack scientific evidence to support their claims. While some ingredients might show promise in laboratory settings, their effectiveness in real-life scenarios is often questionable. Take minoxidil and finasteride, for example. These are FDA-approved medications for hair loss, but they only work as long as you continue to use them. They also require a doctor's prescription and can have potential side effects. It's crucial to approach hair loss treatments with a healthy dose of skepticism. Don't be swayed by marketing hype or anecdotal evidence. Always consult a qualified dermatologist or trichologist to determine the best course of action for your specific situation. Hair transplantation has become increasingly popular, but it's essential to have realistic expectations. Many clinics showcase impressive before and after photos, leading some people to believe that a hair transplant can magically restore a full head of hair, regardless of the extent of their hair loss. However, this is not always the case. Hair transplantation involves redistributing existing hair follicles from the donor area to the recipient area. it doesn't create new hair follicles. In cases of advanced baldness, the donor area may not have enough healthy hair follicles to cover the entire balding scalp. It's crucial to have an honest conversation with your surgeon about what's achievable in your specific case. They can assess your donor area, hair characteristics, and overall hair loss pattern to determine realistic expectations. The demand for hair transplants has led to a surge in clinics offering these procedures. However, not all clinics are created equal. Some operate without proper certification or employ unqualified technicians, putting patients at risk. These unlicensed clinics often lure patients with low prices, but the consequences can be dire. Poorly performed transplants can lead to infections, scarring, and unnatural-looking results. In some cases, the damage may be irreversible. It's essential to do your research and choose a reputable clinic with experienced and board-certified surgeons. Don't be afraid to ask about the clinic's credentials, the surgeon's experience, and their track record. Hair transplants rely on healthy hair follicles from the donor area, usually the back or sides of the scalp. While this area is generally considered resistant to hair loss, overharvesting can occur if too many follicles are removed. Donor area depletion can lead to thinning or patching in the back of the scalp, which can be difficult to conceal. In some cases, it may require further corrective procedures. A responsible hair transplant surgeon will prioritize the long-term health of your donor area. They will carefully calculate the number of grafts needed, leaving enough hair in the donor region to maintain a natural appearance. When researching hair transplant costs, it's crucial to be aware of potential hidden expenses that can significantly impact the overall price. Some clinics advertise low base prices to attract patients, but fail to disclose additional fees for essential aspects of the procedure. Hidden costs can include anesthesia fees, medications, post-operative care supplies, follow-up appointments, and potential corrective surgeries. These additional expenses can add up quickly, turning a seemingly affordable procedure into a costly endeavor. Before committing to a clinic, request a detailed breakdown of all costs involved. Don't be afraid to ask questions and clarify any uncertainties. Transparency is key when it comes to financial matters, especially in the context of medical procedures. After a hair transplant, it's not uncommon to experience a temporary shedding of hair in the surrounding area. This phenomenon, known as shock loss, can be alarming, but it's usually temporary. Shock loss occurs due to the trauma of the procedure. The transplanted hair follicles, as well as the surrounding hair, go into a resting phase and shed. This shedding typically starts a few weeks after the transplant and can last for several weeks or even months. While shock loss can be disconcerting, it's important to remember that it's usually a temporary phase. The transplanted hair follicles are still viable and will eventually start producing new hair. Many people view hair transplantation as a permanent solution to hair loss, but this is not always the case. While transplanted hair follicles are generally resistant to the hormone that causes male pattern baldness, DHT, they can still be affected by other factors. If the underlying cause of your hair loss is not addressed, such as an autoimmune condition or nutritional deficiency, the transplanted hair may also thin or fall out over time. In some cases, ongoing maintenance treatments like medications or platelet-rich plasma therapy may be necessary to maintain the results of the transplant. It's essential to have realistic expectations and understand that hair transplantation is not a one-time fix. It's crucial to address any underlying health issues and maintain a healthy lifestyle to optimize the longevity of the transplanted hair. Unfortunately, the hair transplant industry is not immune to unethical practices. Some clinics, driven by profit, may prioritize cost-cutting measures over patient safety and well-being. This can manifest in various ways, such as using unqualified technicians to perform procedures, using substandard instruments or materials, or failing to provide adequate post-operative care. These unethical practices can have devastating consequences for patients, leading to infections, scarring, unnatural-looking results, and psychological distress. In some cases, patients may require extensive corrective procedures to repair the damage. It's crucial to be vigilant and choose a clinic with a strong ethical reputation. Research the clinic thoroughly, read patient reviews, and don't hesitate to ask about their safety protocols and ethical considerations. While hair transplantation is generally safe, like any surgical procedure, it carries potential risks and complications. It's essential to be aware of these possibilities and discuss them with your surgeon beforehand. Some common post-procedure complications include infection, swelling, pain, numbness, scarring, and unnatural-looking hair growth. In some cases, patients may experience pluggy results where the transplanted hair follicles grow in an unnatural clumped pattern. Choosing an experienced and qualified surgeon can significantly reduce the risk of complications. Following your surgeon's post-operative instructions carefully is crucial for a smooth recovery and optimal results. Remember, research is crucial. Investigate the credentials of clinics and surgeons before committing to a transplant. Prevention is better than cure, so address underlying causes of hair loss before opting for invasive procedures. And always prioritize ethics over cost. Stay informed and take care. We've covered a lot of ground today, from the hidden causes of hair fall to the potential downsides of transplants. But remember, knowledge is power. By arming yourself with the right information, you can make informed decisions about your hair and your health. Would you like tips on alternatives to transplantation or reliable methods to restore hair health? Let us know in the comments below.